Hello everyone. You're watching sqadia.com and I am Dr. Hamad Haider. Today our topic would be the Legg Calve Perthes disease. We'll be discussing this pediatric conditions and we'll starting off what we see with the patient of a Legg Calve Perthes disease on its X-ray. When we get an X-ray pelvis AP view, there are certain things which we need to look for in the case of LCPD or Legg Calve Perthes disease. For example, we will be discussing what are the changes which occur in epiphysis, over the cartilage, as well as the physis and the metaphysis, and what you need to look for on these X-rays. From then, we will moving on towards the different classifications which are available to classify LCPD. We'll be briefly discussing the different classification, starting up from the Catterall classification and how the grading is done on the necrosis or avian of the epiphysis, and what are the different grades of a Catterall classification. From then onwards, we're moving on towards the Salter and Thompson classification and what is its role in predicting the prognosis of the disease. And we will briefly also discuss that how this Salter and Thompson classification is actually based on the fragmentation, which although occurs in 1/3 of the patient only, and why we need other classification systems as well. From then, we're moving on towards the Herring classification, or also called as the lateral pillar classification. And I will be briefly discussing in detail that why we have Herring classification now as compared to other classification, because the problem was to predict the prognosis of the disease. From then, we're moving on to the Waldenstrom staging. We'll be discussing what happens when the pathophysiology will be discussed of LCPD. We'll discuss what happens when the infarction occurs or the initial stages at infarction has occurred. From then onwards, the bone leads into sclerosis and fragmentation. From that goes to reossification and remodeling, and we'll be discussing how the reossification and remodeling occurs in the case of LCPD. We'll be discussing different signs such as metaphyseal cysts, cage sign, and then vertical epiphysis as well. And I will briefly explain on the X-ray what to look for and what is actually gauge sign and what to look for other signs of LCPD as well. From then, we also need to understand that we will have some differentials in our mind. We need to get other views as well to rule out scaphy, to rule out proximal femoral osteomyelitis, to rule out acute transient synovitis, as well as the septic arthritis of the hip joint, which can mimic some signs and symptoms of the LCPD as well. Once we have made by our history and examination, we would have made our diagnosis in the video. Then we will moving on towards what are the treatment of this scaphy, whether we need to go for some form of containment with pelvic osteotomy as well as proximal femoris varus osteotomy, or we need to do some form of a salvage procedure, whether in form of a certain salvage osteotomy or valgus subtrochanteric osteotomy as well. Therefore, we'll discuss what is actually containment and what should be our aim in the case of LCPD, and then once at what age it presents. That is where we'll be discussing how our different sort of classification actually help us to predict what would be the prognosis of this disease. And if the prognosis is poor, then we may need to intervene early to protect the head from osteonecrosis. We'll be briefly discussing what is established shelf osteotomy, which could be some form of a salvage procedure to buy time, because it can prolong the disease and therefore the patient can be relieved of arthritis, and later on, once the arthritis develops, then we may have options such as total hip arthroplasty. And then we'll be briefly discussing what is the role of once the healed Perthes has come up and we have a large mushroom-like oblong shaped subluxed head, which may actually result in some form of femoroacetabular impingement. Therefore, what are the different procedures, we'll be discussing that in detail, and how to go about the hinge abduction and chelectomy, which may benefit the patient or relieve the patient of some form of internal impingement. If you want to watch the complete lecture, go to www.sqadia.com and you can register there and you can watch this whole video over there. Similarly, if you want to watch other videos related to orthopedics as well as any other clinical or the basic science subjects, you can go to www.sqadia.com and watch all those online videos over there. Thank you very much. Keep watching sqadia.com.